An oncology board is a meeting of medical specialists who come together as a team to carefully discuss and evaluate each patient's case. By sharing their expertise and perspectives, they work collaboratively to decide on the best and most appropriate treatment plan for every individual patient, ensuring that the chosen approach is tailored to the patient's unique needs. An oncology board is usually convened for specific diseases, meaning it has its own particular focus. When treating colon cancer, the oncology board must include at least the following specialists. First and foremost, this is a colorectal surgeon. This also includes a radiology specialist who performed the patient's CT scan or MRI of the pelvic organs and can provide detailed information about the tumor characteristics seen in these studies. A radiation therapy specialist is also essential, because their input and opinion are important when deciding whether radiation therapy is necessary. And a medical oncologist, who also determines the indications and necessity for chemotherapy. A pathologist often participates in the oncology board meetings as well. This is the doctor who establishes the histological diagnosis. In fact, these important decisions are also based on their opinion and the diagnostic results they provide. An oncology board meeting should take place with the physical presence of all specialists when they gather in one place to discuss the diagnostic results, the treatment outcomes for each patient, and make a decision together. But in many medical institutions, not only in our country but around the world, the oncology board is often quite a formality. Most often, there is simply a list of specialists kept on paper. They collect the specialist's signatures, but the decision is made by just one person. Most often, it's an oncologist who doesn't always specialize specifically in treating colon cancer. In the work of the oncology board, it's very important to first assess the diagnostic results. That's why a radiology specialist is invited. Then, the other specialists share their opinions on whether additional treatment methods are necessary. A doctor who does radiation therapy and a doctor who does chemotherapy. And the surgeon, too, gives their opinion on whether a radical surgical intervention is possible in this particular case. Together, they make a collective decision about the best treatment approach they can offer to this specific patient. If we're talking about rectal cancer, sometimes the first stage of treatment is chemoradiation therapy, followed by planning for surgery. But there are situations when we can start right away with radical surgical treatment, when the tumor is not very widespread, when it's not located close to the anal canal, and in those cases, we can immediately plan a sphincter-preserving surgery, and there's no need for preoperative chemoradiation therapy. The involvement of a medical oncologist is most often required in the postoperative period, after the tumor has been removed, to determine whether there are indications for chemotherapy in the postoperative period, so-called adjuvant chemotherapy, when we cannot rule out the presence of distant micrometastases. And in order to minimize the risk of their development, we can prescribe chemotherapy. Such a decision is made based on the results of the histological examination. When the tumor is removed during surgery, it is thoroughly examined under a microscope, and we receive a report from the pathologist detailing all the characteristics of the tumor, all the lymph nodes, and other parameters related to this particular tumor process. And the more detailed this histological report is, which can sometimes be several pages long, the more informed the decision the oncology board can make. And the more likely it is that this decision will be tailored specifically to this particular patient, rather than just a formal application of some clinical guidelines.